Welcome to Arete Health Fit. My name is Siras Jabari. Today we're going to cover a fantastic quads, glutes, stability focused exercise, the assisted balanced forward squat. Before we begin, our ease principle tells us, regardless of how phenomenal this exercise is, if you do not know how to squat on a flat ground correctly, and if you're experiencing backache, this may not be for you. So please follow the instructions carefully before you proceed to do this exercise. Before we get started on an assisted balanced forward squat, I want to quickly review what it would look like to do a regular assisted squat. You would want to find a post, and if you do not have a handle like I have, you can use a towel as well. You're going to keep the feet about the width of shoulder apart. Make sure you keep the elbow to your side. Your back is nice and flat. You're going to drop the weight back as you proceed to go down, as if you're going to sit on a chair. But make sure that the knees are not going forward or you're not bending forward in order to accommodate that. So at this point, you should have the weight toward the last 2/3 of your feet. In fact, you should be able to wiggle your toes while you're in this position. The only area you should feel would be your quadriceps, your glutes, your abs, what are really stabilizing you while you're in this position. And then from here, you will keep the knees staying in the same position, and then you proceed to push your glutes in to get into an upright position. So again, one more time, you're going to drop the hip back without allowing the knees going forward, making sure that the weight of your body are toward the last 2/3 of your feet. And at this position, all the weight should be on your quads, your glutes, your abs, and then your semi-upright position. And you're able to wiggle your toes. Now that you have practiced doing the squat on the ground, we're going to take you to the next level, the more advanced exercise, as we said, the assisted balanced forward squats. So let's get started. Just like the other squat, you will do is that have your feet about the width of your shoulder apart. You want to have the distance of the board from the post far enough where your elbow can just be right in your side. At this point, exactly the same way, you will drop the hip back, lean gently forward as if you're going to sit on a chair, and make sure the knees are not going forward. Just like flat squat, what you're going to do here is try to wiggle your toes. Now, the phenomenal thing about this exercise is that you will use a lot of the stabilizing muscles, your quadriceps, your inner thighs, your glutes, your abs are all involved, and very little stress to your lower back. Again, the weight should be on your quads, your glutes, and your abs, and almost all your weight should be toward the last 2/3 of your feet. And then once you're at this position, you can come up, squeeze the glutes back up, get into an upright position, again proceed to go down. Here you have a couple of options. Either you can stay here, make sure you continue breathing, and then hold for about 5, 6 to 10 counts, depends upon how advanced you are, or you can move up and down and pause 1 second in the bottom. Yes, I could do this exercise without the assist. What you will notice is that as I proceed to go down, I will have to lean forward to counter the balance, number one. So that means my lower back is going to be in play a little bit more. Number two is that I will not be able to isolate my glutes as well. So you could do this exercise, but assisted balanced forward squat will give you the best of both worlds. One, you reduce the impact or stress on the lower back. Two, you're also able to isolate your glutes better. The assisted balanced forward squat is a phenomenal exercise once you learn the proper technique. Always, before starting this exercise or any other exercise, check with your doctor. Until next time, to your health.